goes this. There goes the encoder. And we are good to go.
Hey, everybody. Thanks for hanging out with us. This is the one and only IT in the D Show, broadcasting live from our quarantine homes. This is Bob the Sales Guy. That is Dave the Geek. Randy, I do the Twitters, is doing the Twitters. Special guest this week, the illustrious one, Mr. Fred Brown, COVID specialist du jour, doctor, scientist of epidemiology. I'll never pronounce that right, and it's your profession, and I don't even know how to say it. Find us online.
He's not an Episcopalian that I know of. He is not. No.
Bob's a sellers guy. How do you pronounce that, Bob?
Right.
Find us online. itandthed.com. Do us a favor, give us a like on the socials, and subscribe to us everywhere. Find podcasts are sold.
Hey, and as per usual, events are what they are. We'll get to them when we get to them.
Yeah, I think
the Ann Arbor crew was trying something remote.
Yeah, I went ahead and canceled the in-person ones just because it was not
confusing. Makes sense.
We can do what pro wrestling does. We can have like an event at like St. Andrews, and we can rent like 600 like 32-inch TVs. And then everyone can be their own TV.
Oh, geez.
And then we can wave at each other.
And then we can put the cast of South Park in front of all the TVs.
I like that idea.
Pretty much. It's about as effective as having all those people in the crowd.
Right. So, hey, we were just saying before the show, I truly cannot believe just how much has happened just since our last show. I mean, we joke about quarantine, and I saw a meme it was like, God talking to Gabriel, and he was like, hey, did you load everything up for the 2020s? And Gabriel went, what? And he was like, what do you mean what? He's like, well, you said 2020s. I thought you meant 2020. And God was like, wait, you put an entire decade of history in 1 year? What's wrong with you?
Tiger King.
Yeah, was 6 months ago. Yeah, no shit.
Popeyes sandwich.
Yeah.
No, you got it. It's who did it first. It's either the Popeye sandwich, the seltzer drinks, or Tiger King. They're the culprit.
I'm drinking one of the seltzer beers right now.
It's your fault, Randy. We all agreed that the world was fine until White Claw came into being. But no, yeah. So God, I mean, it's crazy. Like, so in the last week, we've had the first presidential debate, such as it was. We had, and then all of a sudden, Trump, getting diagnosed with COVID, getting airlifted to a hospital, to now he's apparently been released and he's back at the White House taking photo ops again. So yeah, Fred, how are you taking this past week? Let's start.
I've been involved in 6 epidemics/pandemics, and I've really not experienced the kind of ups and downs we've experienced with this, and that's saying quite a bit, because there are some really sort of
have we had ups? where are those ups?
I believe it's pronounced oops.
Yeah, I think those are oops, Fred.
Well, from the COVID point of view, they're doing quite well.
Umlaut, yeah.
Oh yeah, a lot. I mean, it's really pretty amazing. And I've had a lot of ups and downs in certain epidemics where we ran out of medicines and so on, and this has been pretty unprecedented in terms of what's happening.
And hey, now unprecedented too.
That's right. Yeah, that's right.
Yeah, we were almost unprecedented. Yeah. So, I mean, obviously, I guess what first and foremost, especially on our local listeners' minds, is what's your take on what's happening here in the state of Michigan? So I'm sure everybody knows by now, the Michigan Supreme Court on Friday ruled that basically all of Whitmer's executive orders after April 30th are essentially null and void. I believe earlier this morning, her folks filed an appeal to get that pushed out until at least October 30th, because there's some gray area as to whether or not that ruling takes effect immediately because it's, it was an action by the Supreme Court, or if it doesn't take effect for 21 days because it wasn't really a ruling. They were just answering a lower court judge's question and all that kind of nonsense. So they're looking for some clarification there. So yeah, I mean, I guess let's start there. I mean, and I know you came armed with slides. So what?
I did.
You tell me what works for you, and we'll go there.
I'd be happy to go through the slides, but I literally had to revise the slides at 5 o'clock this evening because everything's changed around again. We
Mm-hmm.
have to know. So I just wanted to let you know. Yeah, it's pretty wild. So you're right. The Supreme Court. Maybe I should show you some of the slides, and then we can sort of break in whenever you want and ask you some questions about it. But so the first thing I should say is I am not a lawyer and I'm not a politician. So I don't really, I've done the best I can sort of assembling what I understand. I've actually talked to a few lawyers about this.
Well, and the sad reality is, let's be clear, even the lawyers and politicians don't understand what's going on right now. That's clear by all the appeals and everything that are being filed. So yeah. And I think that's the truly scary part.
It was a 107-page ruling, and of course there were two parts of it. One was back to a rule that went back all the way to about World War II in 1945. They had a riot. They had a riot act, so you could do certain things if people were taken to the streets and rioting, and the government could create an emergency, a state of emergency, and write emergency orders. In 1976, it turns out they changed that a little bit and said, well, you can't do that indefinitely. You've got to there's a time limit you can do. So you have to go back to the legislature and ask each time you're going to write an emergency order. So on the first round, Governor Whitmore did do that, and she said okay, and the legislature said, you're right, it's an emergency. Let's go out until April 30th and see where we're at. And then, things were happening so fast at that time that Governor Whitmer said, look, I can't keep going back each time. And each time we have a data change,
right.
I have epidemiologists tell me, I got to do this and that. I just can't, I don't have the time. So I'm just going to do the best I can with what I've got. And so she, according to everyone on the Supreme Court, she basically violated the 1976 agreement. That part of the law. 7-0's decision. Everyone said, the law actually says pretty specifically you're not allowed to do that. But on the bigger question about whether she's allowed to do emergency, that she's not allowed to work without the legislature, but on the bigger decision about whether or not these emergency orders go back to the Riot Act or not of 1945, there the court was completely split. It was a 4-3 decision, and I'll tell you a little bit about that. And obviously this was brought against Governor Whitmer by our own House of Representatives and our own Senate. So clearly there's a lot of politics going on with her being Democratic and our House and Senate being Republican.
Right. And so one of the things I just learned today is this exact same scenario played out in Wisconsin.
That's right.
And Wisconsin, let's be clear, is currently a shit show.
Yeah, Wisconsin has a 20. Right now, our percent positive rate for tests are in the 3% range, and theirs is in the 22% range, and that means that you're under testing. Plus, you've got just an awful lot of COVID all over the place, and that's the risk, right? And so what I tried to do was I actually do a lot of modeling, as you know, and so I actually tried to model what's going to happen if we loosen all these restrictions. And interestingly, it turns out we look.
Hold on. I'm gonna go pour myself some bourbon. I gotta every time you say you've got models, I'm gonna.
Yeah, turns out we look like Wisconsin pretty fast.
Go figure.
Without any regulations.
Well, so and that's the thing. If I recall correctly, the last thing that she had put out before this news broke on Friday was that she was rolling back the open on the UP because of all the cases that were crossing over from Wisconsin and the spikes that they were seeing there. And they're seeing, again, they're back to hospitals being full, death rates climbing, all that kind of fun stuff. So, yeah.
Yeah, and in the UP, you're right. It's interesting. You can actually see COVID sort of lining up along the Indiana, Illinois border, and you can see it lining up right against the Wisconsin border, and it's just waiting to come in. You can see the testing spike.
The worst version of this is Sparta that I've ever heard.
Well, luckily we're sort of a peninsula, right? So as we know from
right.
we can do we sort of can hold things off, especially moving up against Canada, which is really looking great. So at any rate, this is what I got so far, what my understanding. And again, I've said, note, I'm not a lawyer. This is from news articles written by lawyers. And by the way, I consult to a lot of states. So I consult to 17 states, 6 national governments, 2 major Department of Defense and State Department agencies, lots of NGOs. So I do know a lot about what other states are doing, but in Michigan, I don't have an inside track. So this is just my understanding based on my experience with government, what's going on. So when they struck down the Riot Act and the 1976 Reinstatement Act, basically, Governor Whitmer stressed about 200 COVID regulations, and this struck down 160 of them. So the vast majority of the regulations were struck down. And I'll go into the ones that are really important. Almost all the ones that are really important were struck down, and they basically effective 21, as you pointed out, Dave. 21 days from now, basically this means that what she's done is unconstitutional and will be rescinded and pulled back out of the law. And immediately, of course, the AG is no longer going to enforce those regulations based on the Supreme Court's decision here.
Yeah, honestly, like that was one of the like really concerning things that I saw today was the statement that came out by the AG. Yeah. Literally telling people, go ahead and burn your masks. You don't need them anymore. Like
we got nothing.
Like that was a quote, and I don't even know how to react to that. I
just can't even imagine the hell that's going to happen at stores that maybe.
Oh yeah, you thought it was bad now? Oof.
Oh man.
Yeah, see enough of these videos now. Yeah.
Did you see the post from Bobcat Bonnie's earlier?
Yeah.
Yes.
Yeah, I would say, same, like, and they're basically like you got a lot of places that are just like, look, we're not taking it anymore. You guys are being jackasses to our staff, and we're just going to kick you out from now on, which is how it should be.
And I don't understand why. Like it doesn't. Like I'm so thankful to be able to eat on a patio. I can't imagine yelling at anyone. But then again, I'm.
Well, I was up north, and it's pretty calm up north, and things that are actually in pretty good shape up north where I was. And every store, my wife wanted to go shopping, so we went to all these different stores and looked around, and every store had sort of a discussion about the fact they'd had to, ask people to wear masks, please, and there were always a few people who were every day they had sort of an incident, a micro event that was challenging to manage. And gosh, it's gonna this is gonna make it even worse, right? We don't even know what side of the law is right anymore.
Right.
It turns out that the HHS has some authority to limit crowd size in the event of epidemics. And this goes back, believe it or not, to the Spanish flu. So back in 1918,
right,
and this was not, and this wasn't asked. The state Senate and the state House of Representatives didn't say anything about this particular law. So we'll see what the result is about that in a second. But interestingly, the HHS has some authority, but their enforcement ability to do this across their little regional boundaries and so on is very limited. So we're not sure how that's all going to work. And of course, the court mentioned that the governor can work with the state House and Senate to enact COVID legislation in the future. But things it's hard. And I'll get into why that's so difficult in my experience in working with state governments, just because COVID moves so quick. It's hard to get regulations in place that anticipate what COVID's going to do.
Well, you've already seen, I believe it's the lead Republican senator for the state basically come out and say he doesn't support a mask mandate at all. So,
plus the state Congress is not going to be in session until after November 3rd currently. So
right.
Well, that's the weird thing too. Then you have county splits. Macomb County's like, nope, no mask. Oakland County's like, yep, mask. So
Wayne County is also
John
yes.
R, apparently.
Yeah,
DeQuinder's the border.
Apparently is that line.
DeQuinder's the border.
Left of John R.
That's right.
What's that?
DeQuinder's the border.
So you can.
Oh, that was John R.
And so it's really wild, right? As soon as you cross the little border, all of a sudden you're going in from Michael Duggan's environment to Macomb County, and suddenly everything changes again. Right? How do you manage that?
It's like the old days when you had non-smoking sections of restaurants, like we know, or trying to have like a no peeing section of your pool, like that. It just doesn't work that way.
Yeah,
there used to be smoking sections in planes.
Come on. Oh yeah, even better. Yeah.
Hey, you know what? Thank goodness, because it turns out because they had to do that in planes. I'm working with a couple of major airline companies. We recirculate the air about once every 2 minutes in planes because they're all designed to take care of smoke. And so actually that, you get quite a bit of fresh air in airplanes, as it turned out, not because we planned it this way, but just because we had to
Interesting side effect. Cool.
So it turned out that there was some healthy effect of smoking.
Smoking helps. I just want to put that out there.
Don't quote, no, please don't quote me. Don't do that, especially with COVID. That's all you need is more smoke in your lungs, and then you have predispositions toward COVID. Trust me, you don't want to smoke. You're smoking anything in the COVID environment if you can avoid it. At any rate, so that's sort of my understanding of the legal situation based on my work with other states. And what's interesting is that basically there were 5 big mandates, right? That Governor Whitmore especially was worried about. The first one was the mask mandate, and basically you can see what the mandate said originally. If you're indoors, if you've got to maintain 6-foot distance, especially if you're on public transportation, even if you're outdoors, and you can't maintain a 6-foot distance, please wear a mask. So that was the rule, and of course this struck that down. So suddenly we were in a situation where masks are no longer enforceable until the 21st. You're right, Dave, about that 21 days. We do have from the 2nd until the 23rd, when the lower court then has to accept the Supreme Court decision and then make their final ruling. So they have the 21-day period at least that'll transpire. Okay. So what was interesting was that you can see a little blue dot. Mm-hmm. This mandate was reinstated by the Health and Human Services today at 4:58 p.m. Director Gordon wrote a note that said, based on Michigan Civil Law 33-2253, suddenly I have the authority to create this mask mandate, and this mask mandate will continue to be in effect until October 30th. And so he has reinstated this, which is sort of interesting. So there's sort of a political game going on, but it's only until October 30th, and I'm not sure what happens thereafter. I think thereafter, obviously, he's going to have to.
The election happens after.
According to Bob, the election happens in the Southern year.
There's a little election that's happening. Exactly. So there'll be a chance for the citizens to put this to vote, and I think it's going to be an important decision that you have to make on that day. So that's the first big mandate.
That's okay. The asteroid's going to hit on the 2nd, and it'll all be a moot point anyway. So yeah.
No, I have friends in astrophysics, and they promise me no asteroids are in the area. But there could be some hurricanes and things, but no asteroids. So restaurants at 50% capacity, and basically there are 20 rules that the Governor Whitmore over time put into place, and there were a lot of things about indoor dining has to be limited to 50% capacity. Groups have to be separated by 6 feet or more. They also require that you have to wear masks when you're going to get up off your got off away from the table and you're walking around. You can't be coughing on people and get on your way to the bathroom, that kind of thing. So you have to wear a mask then. All the self-serve areas that you see closed down now, that's because of this mandate. All the drink stations closed down because of the mandate. All the common areas, you can't dance, you can't mingle. And if an employee shows symptoms, you got to close down, right? So all those things are pretty common. In the states that I work with, on the 17 states that I work with, every one of them has this either in place as law or in place as, suggested heavily by the law.
Right.
Now the difference between the law and not the law and suggested is if under the states with the law, like Connecticut and so on, you can get fined and have misdemeanors charged against you. In the places that are suggested, those things don't happen. So that's the big difference between if it's in the law or suggestion. So like in Connecticut, you'll love this. And Connecticut is a state that I did do some work with. They actually, if you come from certain states that have high positive rates, you come back, you've got to sign a little note, even if you're a Connecticut resident, saying, I was in this state and I'm going to self-quarantine for the next 14 days. And if you're found out by your neighbors that you haven't self-quarantined, that'll be $10,000, please.
Wow.
So yeah, there's a real penalty, in some states for not for breaking these rules. And of course, Connecticut really suffered. I mean, they were on the tail end of the New York piece, so everything that in New York.
I think New York and New Jersey were right there, so that makes sense.
Yeah, so they felt like they really had to do some things, and it was supported by the citizens. In our case, we haven't had that. We haven't had quite as bad an experience as that, so that we're not at that level. But it's sort of interesting that the different states doing different things. The gathering limits was the next big area that Governor Whitmore passed. That was one of the big 5. And she was actually scheduled to, sort of open up the gathering limits slightly more than they were.
Right.
And so, indoor venues hosting 20 people per 1,000 square feet, as long as they wear masks. Outdoor 30 per 1,000 square feet, up to 30% capacity, 1,000 people in the arenas, and so on. And so that was what she had planned to do. And actually, the HHS reinstated the lower recommendation. So this is a little bit more tight now than what Governor Whitmore was planning to release on October 9th.
I was gonna say, I know a lot of places that were planning on not obviously getting back to normal, but we're planning events.
Oh, absolutely.
With limited capacity and all that stuff starting next weekend or this weekend now, I guess.
And now it's probably gonna now it's been reinstated by HHS through at least 10:30.
Yep.
Again, late this afternoon. So I was literally typing this up a few minutes before I'm talking to you guys. Then we had the bar closures. The bar closures, July 1st, Governor Whitmore closed down all indoor services at bars in Michigan that had at least 70% of their sales coming from alcohol. Well, unfortunately, we don't really track sales data like that, and so it was impossible to enforce. So in fact,
it was very much an honor system. I think we all know places that have never sold so much as a chicken strip that were staying open under this claim. So yeah,
alcohol sales are up 15%.
Your Coke sales are up 30,000%.
Yeah, it turns out that private alcohol consumption is really up by 15, 18% across the whole U.S. A lot more.
I have no idea what you're talking about. That is, I have no clue why that would be.
Now, interestingly, they partially reinstated they didn't close the bars, so the bars can remain open now. But you can't mingle, you can't get too close together. You're supposed to maintain the 6 feet. You're not supposed to have open areas where you're self-serve and things like that at bars, which makes sense. So you don't want to start sharing peanuts and things like that with
right.
So this has loosened up some even with the HHS partially reinstatement.
Well, so I guess just real quick on that one, what are your thoughts on how that's going to look? I mean, let's be real. It's October 5th. This is Michigan. I know a lot of places either, it took over, sidewalks or parking lots, or, there are places like Temple Bar that went out and poured a huge patio out back, and, and that's great, but it's still open air, and this is still Michigan, and, it could start snowing quite literally any day now. So.
Yeah, last year we had October 20th, wasn't it? Something
yeah.
like that. Something before Halloween, we got like 12 inches of snow. It was wild. What I've done actually, I'm helping some schools with this. Now, admittedly, the schools are in California, so a little bit different temperature. But
right.
we bought outside kerosene lanterns and things like that, and they can get pretty warm and keep you going for some time. The problem is in the bars, that it's loud enough where you have to shout. And you're drinking quite a bit, so you're pretty friendly, and you let your guard down often, and you're with friends frequently, and so it's just hard to keep your guard up in a bar, especially if they're at tight quarters. So I choose carefully where I have my drink.
For sure. I mean, honestly, that's one of the things that I love about what Temple's done is so they've got tables out back. They don't even want you coming up to they don't want you going back inside to the bar. I mean, there's probably a staff member, a bartender that comes out every minute or two. Just hey, you need anything? You good? Hey, you need anything? You good? Hey, you need anything? Just to keep that from going on.
Yeah, and that's really good practice compared, and then there are others who don't have that opportunity, and so they're going to try to, possibly squeeze you in, and
right.
I'd be careful about that, especially because the flu season's coming, and you don't.
Yep.
It's just tough out there. The worker office space also, office workers in Michigan who can work remotely are required to keep working remotely. That actually is no longer in place. What is in place is to say that if you are not a family member, not with your family, there are distancing requirements. So that part of the offices are under that part of the full statement. But when I looked through what Director Gordon had put down as far as worker office space, I don't believe he said that you must work remotely if you can, and that includes now Upper Peninsula as well as Lower Peninsula because of their outbreak. And
because that was part of the rollback that she announced for the UP was coming down hard and heavy on that again.
Yeah, because most of the areas where you had a little bit more concentration of population, it was just a mess as far as outbreak goes. It was really pretty bad, and of course, the health services up there are thinner than they are down in major metro areas. So just a little bit, all of a sudden, you're overwhelming the systems. So what was interesting is that each violation charged a misdemeanor with up to $200 fine and up to 6 months in jail. So that's interesting. That's a little bit tougher actually than some of the executive orders that were in place that didn't include jail time under Governor Whitmore, and a fine up to $1,000 per violation. So if you do this a few times in a row, and people tell on you, all of a sudden it starts to add up, right? So you got to be careful. And what's interesting is the local health departments are authorized to carry out this order with law enforcement acting as, quote, departmental representatives. So apparently, as long as the local, government is approving, you can get help by your government representative.
I just want to, so I'm just thinking back to my own experiences and who I've seen walking around, because where we have our studio in Cass Corridor, they're a food court kind of thing, and there's been somebody from the health department there at literally every time I've been there. So isn't that who's already been doing this, or has that been a mixed bag?
That's been so they're doing that under other jurisdiction. In this case, they're using jurisdiction of the epidemics, which gives them and then they're pulling people in from law enforcement to help them do things more immediately and with consequences as far as this misdemeanor and
Gotcha.
and fines. So yeah, they're ensconcing the people into their department suddenly. And of course, certain mayors like Mayor Duggan said, in Detroit, we want to put this together. And if you look at the different mandates, and the mask mandate, the restaurants at 50% capacity, the gathering limits, bar closures, worker office spaces, those are pretty common. Almost every state in the country has been saying masks are a good thing, whether it's part of the law or part of the recommendations. Restaurants at 50% capacity, here that's less. Here it's sort of, I'd say a quarter of the states have said, no, restaurants can open fully, bars can open fully. But probably about, I would say at least 30 of the states are 30 to 35%, 30 to 35 of the states are saying no, bars should remain at 25 to 50% capacity, same with restaurants. And the worker office space also is pretty common in most states. So this isn't out of the normal. In some states where I am, it is, but most of those states are pretty far out as far as their rules and recommendations.
So I know one of the things that I'm quite sure will be of concern to some people. So I know it was her state of emergency that kicked in the additional PUA with the unemployment stuff. So does that now go away as well?
I do not believe so. I'm not sure, but I think that's one of the 40 that remain.
Okay.
That are still okay. But I haven't read the full 107 pages of the report.
Why not, Fred? I mean, there's only so many. I mean, you've had 2 whole days.
And most of the,
not like you've had anything else going on.
Most of the lawyers I've talked to also haven't read the whole thing.
Oh,
so they're all going on. No, Brad, I think that's pretty much right. But
it's the old you got to sign the bill so you can read it and understand what's in it move. I see. Yeah.
So you got to pass the bill to find out what's in it. Yeah.
That's right. Oh, now I can read it. That's basically the big 5 orders, and you can see what Director Gordon did is he's tried to reinstate those big 5 orders under a different law, and we'll see if that holds or not. But what I tried to do is I tried to say, so now suppose that our Supreme Court stands and the state and state Senate and state representative stand the way they are. If that happens, actually we've run the models. You can go to the IHME model site, and you can see they've actually modeled what happens if you loosen the regulations. So they've actually modeled this out for us. And I have a model also. My model is a little bit different than theirs, but from a order of magnitude standpoint, almost every model in the United States, we've got 30 of them going right now, and 30 of them that are big, that are publicized, and probably several thousand that people are running just on the side. And you can see if the court ruling stands, and in November, at the end of October, the lower court says all this stuff is unconstitutional, which is likely. since it is the lower court responding to the upper court, that, starting in around 2 weeks into November, we'll start to see a pretty big increase, a pretty rapid escalation of cases. It'll happen that rapidly because we're all moving inside. The flu is there, and so.
Well, and we've got Wisconsin to look to as a case study right now.
And Wisconsin is going to look like look comparatively good because in Wisconsin they're staying outside, but in November it's going to get cold enough we're all going to be going inside. And the COVID
doesn't Wisconsin only have like 1,200 deaths or something, 1,300 deaths? I mean, they stayed well under the radar with this thing throughout this process.
They did.
Doesn't mean it's not going to get it now, but I'm just saying.
Yeah, no, and that's the thing. I mean, because their governor, so that's the thing. I mean, there's actually a lot of parallels between Michigan and Wisconsin when it comes to, Democratic governor, Republican legislature, what the Democratic governor did, what the Republican legislature has done. So like we're now catching up, sadly, to what Wisconsin has done. And so, yeah, I mean, so like I said, they're now reporting, their hospitals are hitting capacity. In fact, a lot of their hospitals are hitting capacity. Their death rates are starting to climb. So it's, yeah.
Appleton, Green Bay, those are cities that are in big.
Well, yeah, your population density, yeah.
Yeah, and then Appleton has a big college and Florence and so on. So at any rate, so if you run all the numbers, and this is IHME, so IHME is the model that actually President Trump uses and the federal government uses. There are probably 30 others that are used. The CDC uses Los Alamos model, but they all say about the same thing. They're all quite consistent about this, and they said basically, look, if you want to go ahead and release all the mandates that Governor Whitmore put in place, then by the end of the year, you'll have about 45,000 new cases, versus about 7,200 cases if you relax.
As I see, I'm noticing, those two curves go really different ways. Yeah.
Yeah. Now my model's slightly different. I don't go down quite so much, but I start up a little bit faster than they have, and I don't go quite as high as they do. But at any rate, on an order of magnitude basis, it's within 10%. So what you do then is you say, okay, how much does it cost for 37,000 extra cases? And you do the math, and according to Avalier, which is probably the top consultant in this space, based on reimbursements, average reimbursement for COVID per patient, if they go to hospital, is $23,489. Now, if you are uninsured, that price goes up to about $73,000. Yeah. If you are insured by a commercial payer, it's about $35,000, and Medicare, Medicaid is in the $12,000 to $15,000. So you can get a sense of just how wide the costs are. So if you're uninsured, be really careful. You don't want to screw with this thing and get to the hospital. You're getting the kind of service that President Trump is getting right now. It's expensive. It's expensive service. So that's going to cost us about $177 million, and that's getting up there. But then when you think about what else happened with COVID, we talked about last time, you get these long haul effects,
right?
Where about a third of the patients have permanent problems with their lungs, permanent problem with their heart, permanent problem with their brains, fuzzy and permanently fatigued. And what I did is I said, well, let's take a look at general costs. And on average, if you've got COPD, which is scarring of the lungs and having difficulty breathing, it costs about $5,230 per year. Now, don't forget, some of these patients have neurological issues. That's cost about $50,000. That can cost upwards of $25,000 to $50,000 a year, and heart patients cost even more than that. So I've been trying to take sort of an average. This is sort of probably a low side if you think about how much it really costs to treat a major lung problem. It looks like you've got glass scarring in your lungs, but let's take a small number. That's fine. Well, for 12,427 patients, this is going to cost us $1.3 billion. And this is only after 2 months. This is only after 2 months. This is from November to December of this year. So this is getting to be pretty expensive. This kind of a ruling. Now, the other side of the equation is, of course, we got a lot of people who don't really like, are having mental problems because they're all cooped up, and we've got a lot of problems because these businesses are shutting down. But this is not chump change.
So I have to ask, and
yes.
I just based on you, I'm going to assume the answer is no, but who knows? Maybe I'm wrong. Did you happen to watch the pandemic episode of South Park?
No, I didn't see that. I haven't watched, I have not watched one movie about pandemics. I heard there are 3 or 4 great ones, and I should be watching them, but I have not seen one of them.
I was just curious because it's because it's all about kids, and and one of the kids is like basically projecting his own mental issues about being all cooped up onto one of his friends and all that. So yeah, I was just curious.
Oh yeah, well, a lot of that's true. We got a lot of.
And the moral of the episode is don't get drunk with Mickey Mouse.
Yeah, basically. Yeah.
Don't make Fred watch that episode, dude. Don't make Fred watch that, for the love of God.
Oh,
He's a saint in my eyes.
I'll send you a couple relevant clips, Fred. That's all you need to watch. Yeah.
Okay, it's a deal. Well, at any rate, these numbers come from the CDC. They're very accurate. Michigan's actually about 10% higher than most of the other states, frankly, in terms of our costs. We're well insured. But let's keep these sort of as order of magnitude types of costs.
Right.
So then the deaths, each of the cases, of course, comes death. According to the projections, and these are pretty conservative projections, we're going to have 3 times the death rate as a result of a rolling back of the mandate, should they be found unconstitutional, and should Director Gordon's efforts be not right. So we'll have 3 times the death rates, and you can see that back in April we were really suffering quite a bit with 145 deaths per day, and the projections here, again, these are IHME model projections, and they're about right, are saying we're going to have 250.
And that's by January, yeah.
By January. And of course, what about these curves is they don't just come down. These aren't normally bell-shaped. We see a bell-shaped curve. That's because we work really hard to get those numbers down. If you do nothing, it's going to keep going until it doesn't find any more kindling to catch fire. Right, and we got a lot of kindling out there. Only about 10% of us have been exposed to this thing. So that's sort of what death rates look like. And then when you start to say, how many extra deaths does that all add up to? The answer is about 2,019 extra deaths is what they're saying over the next 2 months. So in 2 months, we'll have 2,000 extra deaths. And if the government actually assigns a value to the GDP of every productive person in the United States. And even when you hit 65, 70, those values remain pretty close to this. And you can see that the cost is about $20 billion by those estimates of lost productivity as a result of the people dying. And all these extra hospitalization also are occurring. So all this stuff was taking off as we ease these limits. And one of the questions is, how big has the imposition been, right? I mean, gosh, we've been struggling hard. Well, believe it or not, we actually do surveys of this. And
how annoyed are you?
Well, actually, we look at, are you really wearing your mask or not? And and this is from University of Maryland, as I recall. They look at every state. They go out and they monitor how many people are wearing masks, aren't wearing masks, what conditions, and so on. And you can see that in Michigan, we're at about 35% compliance. So about 35% of the time, we're wearing masks in public as we're supposed to.
Doesn't surprise me at all.
Yeah, and if you think about it, I'd like to think I'm a little bit better than this, but even I'm not. I'm not that great. I'm at around probably 40-50% maybe. And I'm out a lot in what I think is pretty open air. But I guess I would be dinged by University of Maryland on their survey. What's interesting is they contrast this with other countries, and the best mask wearers in the world are the Taiwanese. I mean, they must be wearing masks in the bathroom, and going to bed every which way, because they're at 95% plus on the Maryland survey. So it is possible to get really high numbers. And if you now in Taiwan, it's sort of interesting. If you're found without a mask in Taiwan, I mean, they can fine you huge amounts of money.
Well, yeah. I mean, and honestly, like that's the only, yeah. I mean, there's no penalties here. Like, I mean, I've watched, and like we touched on it earlier. Like I've seen people walk into, whether it's a 7-Eleven or whatever else, and start giving whoever behind the counter crap, and they've got a sign out front that says, look, you've got to have a mask on to come in. there's a sign like right on the plexiglass as soon as you walk in that says, hey, you've got to have a mask to come in. And so like, it's no different than no shirt, no shoes, no service. Like that's how that goes.
No
It's
dice.
no dice. But yeah.
Now, Fred, is that when you say mask in public, is that indoor, outdoor? Is there any delineation?
That is indoor and outdoor and public. They call it in public. They call it in public. That's the standard. And in Taiwan, it turns out they even are monitoring you in your home. Same thing in Singapore. I mean, I consult with these countries, and if you're found without wearing a mask appropriately, even in your apartment building, that's $50,000, please. And every time you're found, it's a lot of money. Yeah, wow. And so in Switzerland, you not wear your mask a few times, it's hundreds of thousands of dollars, and they will collect. Trust me, they collect. So and in Hawaii, we did the same thing. We find some people. We find some people $10,000 when they weren't quarantining like they were supposed to when they went on the island, because they were really concerned about spread rapidly. So if you go to Hawaii and you break the quarantine laws, that'll be $10,000, please. Yeah, and they're pretty serious about it. So there are different kinds of enforcement, but generally, people who are fined a lot, they learn fast. They shouldn't be. So what's interesting is that I don't think these executive orders have been that usurious. They haven't been that tough on us. I think they're followable. I think they're reasonable. I think they're pretty reasonable. But there are a lot of people who really object to them. Which is I understand, especially if it impacts your business adversely, and if you really think there's not an impact for wearing a mask. It turns out that we're pretty sure now that wearing a mask will reduce the transmission of this disease by about 5 to 6 times in the same environment. So that is a pretty big factor.
Right.
I mean, that's sort of what the science is showing us right now. But the imposition level, I understand sometimes some people don't like. I don't like wearing masks all the time. It scratched my face. I have to admit. So, but with over time, I'm going to get used to it. Now, what's interesting is they also look at mobility. So they'll actually look at your phone, and you can see that back in April in Michigan, we were way down in our mobility. We didn't go anywhere at 70%. So the question became, how are we doing now? And the answer is, right now we're down about, compared to 2019 at the same time. We're not moving around about 9 to 10%. We're moving about 9 to 10% less than we were back in October of last year. So 9 to 10%. That's probably about right for me. Maybe I'm doing a little less mobile than that, but in that range. What's interesting is that what they also calculated is, suppose you wanted to reach the same level of security in your health if all the mandates were removed. How much mobility would you have to constrain yourself by to reach that same level of health if Governor Whitmer's rules were in place?
Right.
Here's the level of health I got with in place. In order to hit that, I've got to actually reduce my mobility 63%. So because some guys don't want to wear their masks and they push the governor in a certain direction, I have to reduce my mobility by 63%. People who do want to wear their mask, do want to be safe, have in order to avoid those people who are so upset about wearing the mask, I've got to reduce my mobility by 63%. So it's a pretty big imposition on me,
right,
to be around this environment where suddenly we've got no mandates anymore. If I want to retain my level of health that I had under the mandate, that makes sense. That all good. So that's a big change in mobility. I've got to go back to where I was in April, when I wasn't going anywhere in April. So it's sort of interesting to see that contrast. Here's the imposition of the mask versus here's the imposition of the person on mobility if I don't wear that mask. And it's a pretty big shift.
Yeah.
So here's the real cost, right? The real cost is I work on a number of these big areas in terms of vaccines. I'm working with a number of the companies. I'm working with the government at the highest levels in order to understand when we're going to get vaccines out. And I'll talk to you about that in a few weeks whenever you want, Dave. It's a very complicated discussion, but I'd love to get into it because it's really exciting. We're doing pretty well with vaccines is the answer. We think that by the middle to end of next year, we're going to be ready with a vaccine that's really going to start to reduce the amount of mask wearing social distancing we're going to have because it's going to reduce the transmission levels. We'll have to see how it goes, but we're pretty sure.
So wait, so it's not going to be next month, is what you're saying? That's
I think one company may be out next month. Spoiler alert! I'll tell you now in a couple weeks. There is one company in position to do that, and they're making signals they might make it before the election. So it's still a scenario. Although the other
just because it's done doesn't mean it's ready. That's the
Yeah, we got to get it out there, and it's complicated. Trust me. I'll show you all what the supply chain looks like next time. But it's exciting. It's really cool. But anyway, suppose we take our 2 months and we just say, let's just flatten the curve. Let's say in January 1st, that curve is just going to remain flat all the way out until we get a vaccine in October, and most people are starting to get vaccinated. How much money is it going to cost us not to have all these mandates if we extend the 2 months to the 12 months? And the answer is, well, the likely GDP impact on November and December of just this year of the Supreme Court ruling is $2.7 billion, right? You got the extra cases, the extra regular cases, the extra long haul cases, and the excess deaths. And the problem with the long haul cases and the extra deaths is they stay with us for the next 20 years, right? And the average person is dying at 65. He or she would have gone till 85, and so on. And same thing with long haul cases. They wouldn't have been sick, and so that's a 20-year period. So if we do the math, the best scenario with vaccine control in November of 21, the 1 year impact of the court ruling is about $16.2 billion. That's how much it costs in order to lift all these things up in terms of our health.
That's a lot of money.
Yeah, and it turns out that if you look at how much all the restaurants in the state contribute to our GDP, it's about 17.9 billion, which means that we could have just paid these guys. Here you go. They would have had 100% profit. We're not even talking. We're talking about not their profit. We're talking about their sales, right?
Yeah, right. Yeah, just not even worrying about just covering costs. Yeah,
we could have given them. We could have given them almost all the money they're going to make in the whole year just outright and paid for this mess without really hurting anybody, which would have been great. But we decided to go this route instead, and it's going to be really expensive. I mean, it's going to cost us a fortune, and still no one's going to feel safe going to some of these restaurants anyway. So they're going to have troubles, and they're going to have to do lots of remediation in order to get people to come in. And of course, we're all going to be a lot sicker. And so it's just frustrating to watch this. I'm just surprised we couldn't have come to some better arrangement.
Well, yeah, I mean, and that's a very real thing. I mean, even the places that are open, that are trying to do things right, they're not seeing.
Everyone's trying to do their best, right?
Yeah, I mean, you're not seeing, even half capacity crowds. You're not seeing, and they're all trying to do their best with, takeout and pickup and all that kind of stuff. But.
And I do my best to go out and do takeout at, to the restaurants I like, try to keep them going. And it's tough. I mean, everyone's saying, yeah, it's hard. It's really hard. And the problem is that actually this ruling isn't going to affect us because of the long haul cases and the extra deaths. It's not going to affect us for, just that year, right? It's going to actually drive our GDP productivity down for 3.5% every year. Every year for the next 20 years, we're going to be down 20 because of this decision.
So what you're saying is we're never going to fix the damn roads, Fred. That's what you're saying. That's never going to happen. That's.
Oh man, I'm not. There's a lot. There's a lot of interesting things about the roads that we should get into at some point, but I'm not an expert in infrastructure. I do know a lot about healthcare infrastructure. I know a lot, but as far as the roads go, my only experience has been I drive over a lot of bumps every day
right.
on my car. I don't think they're getting fixed. I'll tell you.
No,
I'm sure people are trying hard though. Actually, around Ann Arbor, we're starting to get a little bit better. I have to say, there are a couple of roads that we're really bumping that are getting better, which is great. They're under construction. I'm working hard. But at any rate, that's the cost of the court ruling. If you look at just what's going to happen as a result in the health sector about COVID alone. Now, it's hard to talk about the whole impact, right? I mean, there's lots of millions of different aspects of this impact. What happens about the people who, don't go to their doctor because they are afraid of COVID? That's going to also increase the deaths even more. As you know, in April, a lot of delays were occurring. There was lots of even bigger shifts in the economy that are occurring in April. And according to the numbers, we're going to be about 70% worse than we were in April. So, that's not going to be a good scene if we let this thing just take off in the fall, because COVID's just ready to go. I mean, it's just sitting there waiting for the cold weather, and letting us all get into our, heated houses where air recirculates and we don't have the windows up. So that's
Well,
the
and that's a good point, Fred, that you brought up. Like all of the restaurants that kind of retooled and gave patios and kind of extended their lives a little bit, that's going to be gone very, very, very quickly.
It's going to be, yeah.
And so now what? That's the problem. So now what?
And I think that's why people were calling up their legislators and say, "Hey, look, Michigan, you're my representative, you're my senator, and my business is going to suffer much more starting October. Can you bring this to court?" And so they did. They were trying to represent the people, their constituents, and there were enough people who were upset about it that they brought it to the Supreme Court. It's just that I think they could have found a better solution, than sort of the all or none, and the Health and Human Services now coming in and trying to steer it back to where it was, which is probably the right answer. At the same time, there's no fiscal support to help these guys out who are having to close down. Right? That's the part that's missing.
Well, I mean, and the interesting part is, I guess you play out that scenario. I mean, even if places do, okay, screw it, we're opening up at 100% capacity, are people showing up?
That's just it. Yeah. You can open the economy, but and what's interesting is I work for states that really have a much worse situation than we do in Michigan. We've done a great job. I don't consult to Michigan, but we've done the state overall has performed really, really well. I give it kind of top 10 scores, frankly, out of the 50 states. Some of the states I work with are really diehard about, we want to keep everything open. We really want to go. And the problem is we keep everything open, but no one wants to go. It's like, geez, so we're getting worse of both worlds. We're sort of sitting there and we kept everything open. So that, there are people who are really gung ho and having super spreader events. And at the same time, there's enough of the population who doesn't want to do that because they're all scared to go, that it kills the economy anyway. So we really got to, the truth is you got to get control of the virus before you can really have the economy open up successfully, because people are just going to make their own decisions. And
it's the old rearranging the deck chairs on the Titanic motif. Yeah.
What was interesting is you could tell that even back in March. We most of the states closed down the period between March and April. That was when things closed down. Some states didn't close at all, like South Dakota and some other states didn't close at all. So what was interesting was, it didn't matter what state you were in. South Dakota had the same amount of mobility decrease, the same amount of economic decrease as New York, because people just, and that started right around March 15th in every state. It didn't matter what the state did as far as the law went. It just mattered whether people felt safe or not.
Right.
In the economy. So it's sort of interesting to watch that move through. So there's one other thing I wanted to show you really quick. I know I'm running out of money, running out of time here, but so the conclusion. There are two other things I want to show you. The conclusion was that basically, one of the things about pandemics is that I've learned is that you've got to over-respond. And the reason you got to over-respond is because pandemics and epidemics and these viruses, they grow exponentially. So if you want to control the virus, you actually have to intervene a lot earlier than people who don't see the whole population picture and just are looking at their own individual situation are aware of. So as a governor, you've got to have all these things out there, or as a state, you've got to have all these measurements out there that are saying, it's starting to go exponential. And nobody, you and me, we won't see that as individuals. But as a population, if you're looking at that and watching it as a population, doing the testing you need to do and so on, you will see that up, and you'll shut down things faster than people who are going to sit back, think about things, consult among themselves, have the legislature get involved. It just takes too long, and by the time you finally say, oh my gosh, we're in trouble, then you're really in trouble, because it goes too 4, 8, 16, 32. It's not 2, 4, 6, 8.
Oh yeah, no, I remember that from one of the very first presentations you gave us, that this isn't a linear progression; it's an exponential progression.
And we just, if you don't hit it hard early, you just get killed. And that's what's going to happen if we don't have these fast interventions. It's a special situation. I mean, pandemics aren't like an economic situation. They're not like a social intervention like a riot. It's a special situation. It's going to take it's going to take some special kind of tools in order to control. And that's something we just have to start to get used to and respond to more appropriately. And sadly, we're going to have a lot more chances to do that because we're going to have a tough fall. So Michigan's not going to be able to respond quickly enough across the state if we allow this ruling to kind of go forward the way we think it's going to, especially going into this fall COVID season where we really are going to have nothing to prevent the COVID from spreading. We don't have a vaccine. We don't have much medicine at all to control this thing, and it'll just have its way with us. It really will. The impact on you is the truth is that we're only about 35% compliance with mask wearing and social gathering and so on, according to most surveys. So it turns out that suppose we get it down to like 25%. I mean, is that going to be a big difference in your personal life? Probably not. And that's probably as far as people are going to go. There are going to be people who are going to be wearing masks regardless. So the big thing is that if they repeal Obamacare and you're not insured, those numbers I showed you that shows how much it's going to cost?
Yeah.
Well, instead of $23,487, it's going to be $73,265. That's how much it costs for uninsured patients on average to go to get their COVID treated. So that's because insurance companies and Medicare and Medicaid, they can negotiate with these healthcare providers and say, bullshit, not $73,000.
Declaring shenanigans.
I'm not going to pay that. But we as individuals, we're not insured. We don't have that negotiating opportunity, and they'll just take it out of your hide one way or the other if you get hospitalized with COVID. And the other big issue is if you got long haul condition, we're finding a lot of people are having long haul conditions, even if they have pretty asymptomatic kind of experience with COVID itself. You can have big problems with your heart, with your lungs, with your brain for forever. We can't solve these problems, and that means you can't. Right now I estimated there's going to cost about $5,200 a year. Well, if you're uninsured, it's $20,000 a year. So if simultaneously we reverse a lot of the impact and get people sicker as a result of having mandates, and then by the way, the mandates that Obamacare put in that says people are going to be insured are also taken away, it's going to be expensive. It'll be expensive. So just now. Just these are bad scenarios, but we should be aware of them and
for sure.
Know what the costs are. On the other side, there may be a lot of people in your audience who say it's worth it to me to have this freedom, and for my business to have this freedom, and I want to have this freedom, and I like what the state senators and representatives are doing. And there are others who are saying, "Gosh, this is really, really expensive when you start to look at the health implications." And so, vote.
I mean,
vote.
You're asking for two things there, Fred. You're asking for people to not be self-centered, and you're asking them to think long term. That's like that. those are antithetical in American society right now. Yeah.
Now I talked a little bit about the best medicines, and what's nice. I hope President Trump obviously gets better fast, and it looks like he's going to be released tonight. I guess it's at 6:30. He's supposed to be released.
Oh yeah, no, he's already back at the White House. Yeah.
Back at the White House. I'm sure they have a virtual hospital at that White House because the kind of symptoms that I was hearing means that he was having some significant.
And that's go ahead and finish this up because I want to double back and ask you about that specifically.
Absolutely. And so what's interesting was they published what he's on, and I think this is quite important. If you are in the hospital right now, or if you have
there's no Big Macs and chocolate shake and Diet Coke jokes in there. Come on.
Nutrition's important. Nutrition's important. Sleep is important. Exercise, all those things.
Yeah.
But once you get the disease, it's less important. Sadly, well, it's still important, but it's most of it's to get your resistance build up in order to fight the virus coming in on that front. But you're right. I can't talk. I am the world's worst junk food eater. So I go to,
I
I
was
go
gonna
to,
say, yeah, there's no cheesesteaks on here. I'm doomed. There's
you know, I go out to lunch with cardiovascular surgeons and guys who are, in this, diabetologists all the time. And they look at what I have for lunch. They say, Fred, you keep me in business because this is going to kill you. I know, but it's just so good. I can't stop myself. But so I've got, so I can't really talk about President Trump's diet, but I'm sure it's quite similar to mine. And I would say that, what's interesting was they gave him the monoclonal antibody cocktail from Regeneron. This is uh, two antibodies they have isolated and found that it has what they call neutralizing effect. There are a lot of antibodies that sort of glom onto the virus and prevent it from coming in. These two antibodies actually seem to actually kill the virus, which are two different kinds of effect of these antibodies. In this cocktail, there's another one. There are a couple others that are coming through. They chose one of them. They're cocktails of 3, 5, and in the case of Regeneron, that's 2. What's interesting about that is that it's still under what they call compassionate use. So you can get your doctor to get you this, you go on to clinical trial and you can get access in certain medical centers in Michigan to this monoclonal antibody. And it sounds like, I've seen a lot of the data on this, and I know a lot of the people who are doing the development on this. It's a really interesting thing. It turns out there's no dose effect. It's a sort of a funny dose effect. The middle dose actually is the most. Normally, what you want to see is, low dose means low response, high dose means high response. In this case, the dose effect goes low for low amounts of dose. The middle dose actually has the highest response, and then when you get too high, the effect actually falls off. So we're sort of worried about that, and we're not really sure whether this drug's going to work. Because normally you'd expect, dose, suppression. In this case, you don't see that. The other thing is that monoclonal antibodies are pretty big, hefty molecules that start to build up in your kidneys and especially in your liver. And so this can be pretty hard on your body. But the doctors who are working with President Trump thought that this was their best option, and that to me was interesting and worth thinking about. What we have, if you can't get the Regeneron monoclonal antibody, then the convalescent plasma, which is on emergency use authorization we talked about last time, is one that doesn't concentrate on 2 antibodies. It's spun down from people's blood who's had the disease, and then you get a collection of antibodies. They're not quite as targeted, not quite as good. So if you can get the Regeneron monoclonal antibody cocktail, get that one. But alternatively, there's ways to block the virus through convalescent plasma that are worth exploring more now, I think, based on what these doctors, and these are the best doctors, let's face it, President Trump has the best doctors in the world working on this. I'm no doubt about it.
I mean, you would hope so, yeah.
Oh, oh yeah. Yeah, I mean, I'm sure they've talked to everybody, and in some cases, I think they even hit my network, frankly, because I got a call on Wednesday about some of these things. Remdesivir is already approved again under emergency use, and this is an antiviral drug, especially good to keep you out of the hospital for lengthy stays. What's interesting is that we caught President Trump's virus pretty early on. These drugs are even more effective typically if you give them early. So he has enough testing going on, and he's going to see this effect even more rapidly than we do. Generally, remdesivir is given after 10 days. 10 days, the hospital is supposed to, reduce your stays there by a small percent. But he may even have a better effect because he got it early. Dexamethasone, that was the steroid. Now those first 2 block the virus. They block transmission of the virus. Once the virus gets into you, it has to reproduce itself over and over and over again, and then it starts to have, really have a deadly effect.
All the other effects, yep.
Yeah, and so the idea is the antiviral stops the replication and the entry into cells, and so does the monoclonal antibody. That's the idea. So you actually stop the virus. All these other drugs here are actually to avoid your body overreacting to the attack. The problem is that after about 10 days, and that's the time to look. Day 10 is typically, people can do pretty well all the way through the hospital. All of a sudden, day 10 is sort of the day that they all hell breaks loose, and they really go into having problems that are deadly, or they're really free and clear. So we got a few more days to wait on that. and he's about next Friday, this Friday, Saturday is when to really watch. So
But I mean, hey, Fred, isn't I've only taken prednisone before. I've never taken that steroid. I mean, I always call that the Hulk smash drug. I could be like as bad as I've ever felt. I take 2 of those and I feel like I'm gonna run through walls. What kind of steroid is this one?
Dexamethasone actually helps. It's similar sort of effect, and it does it makes you feel good, and of course it does stop the inflammation. That's the whole point of doing that. So you don't want to have everything going off at once, and it stops the inflammation in the other organs, especially if you start getting this into your blood. That's where it's really tricky. And you can see the only thing I would say is that he is taking an aspirin that reduces fever, good, anti-inflammatory. It also has an anti-clotting effect because he does have a heart condition. My guess is he's probably on a cholesterol lowering drug as well. But what you might want to talk to your doctor about is low molecular weight heparins. Oh, that's spelled wrong. Apologies. Are a standard treatment. I just put heparin as, so that's lumped together there. This low molecular weight heparin is usually a standard treatment for anti-clotting, and that can be helpful. There are a number of other things that are in experimental stages, ACE2 inhibitors and so on, that can also help with the progression of the disease, avoiding it, keeping it in your lungs, letting your other vital organs getting clots, but they didn't use those. This is the standard piece. So my guess is right now this is kind of the best standard we can find. If you're in the hospital and want to talk to your doctor about it.
So and like I said, I mean, so that was my question. So we've now heard conflicting reports about when he tested positive, when he didn't test positive. The official story came out Friday 1 a.m. There were some people that said the first test positive probably Wednesday. Mm-hmm. So I mean, let's be real. So, like, keeping politics out of it, is this wise? Let's say worst case scenario, best case scenario, Friday, and you're out of the hospital and back at it today, and you're saying it's usually that day 7 to day 10.
Day 10 is the day.
Tweak.
Yeah. So he's, my guess is they got.
Hang on. Fred, hang on real quick. I saw a meme today. This reminds me of it. It was, I hate him. He's a reality TV president. And the next picture is, tell me every single detail about his hospitalization. I'm like,
oh, dude, honestly, that's one of the things I almost posted about, where I was like, guys, like listening to like the press conferences and that kind of stuff, and how deep they were diving on. No, we want to know exactly what his oxygen levels were. I mean, he's still a human being. And he still has certain privacy around him. Like that's a real thing.
I'm glad you said that, because I'm the same way when it comes to personal health care and your own, there's stuff that really should remain private. And I think it's I think, that they've gone way overboard on some of the requests for, revealing exactly all the problems and let's look at chest x-rays and all that. That's just not appropriate.
I get he's the president, and so it's a little bit of a different situation, but still, yeah.
Well, if the guy's driving through a car and waving at people and has lucid discussions during the course of the day on video, the reason that you want to know about the president is whether he's been incapacitated, and right. I think clearly that is not the case.
Well, the person that I knew that had it, they could talk on the phone. They were joining calls. And then they literally had to take like 2-hour naps. They were just out exhausted, like
right.
gone. But they could act for a minute and then just So that's I mean, everyone, the 2 people that I know that have had it, that's the recurring,
Well, I mean, and that's one of the things they said is like the 2 photos that they released were taken about 10 minutes apart. The video that they released shows an edit / break where obviously they stopped filming for a minute and then started up again. And I mean, if you watch like even the like the videos that were coming across from his return to the White House today, man, his breathing looks labored. Like
I'm sure it is.
He looks like he's still forcing it to breathe. So yeah, I mean, like I said, I mean, I'm curious to see what happens. Like you were saying, over the course of this next week. Yeah.
Well, I mean, I hope they have a full hospital kind of situation set up in the White House, right? I mean, that would be because he really is not out of the woods yet. I think by next Friday, by this coming, Friday, Saturday kind of time frame, and things are in okay shape, that would make me a lot more comfortable. But it's
Right.
I'm telling you, you can make that White House look like a hospital room real quick if you wanted to.
Oh, well, yeah.
So I'm hoping that's what he's got, because you don't want him to have an episode and have to that and then not have the right equipment around. That would be bad. So hopefully, I'm sure he's got all that. I mean, these guys aren't stupid.
Yeah,
helping him out. They're the best. So.
All right. Well, hey, honestly, thanks yet again
it was
for
a
taking the
pleasure.
time and scaring the hell out of us.
I'd love to come back and tell you guys about Operation Warp Speed, the OWS, because I think you guys.
Okay.
And it'll take me a couple weeks to get everything cleared before I can actually talk about all this.
Okay.
Is that a flight to get us to Mars? Is that what?
It's the new Star Trek special, Bob. It's the
you guys it's impressive. It'll be, you guys will love it. I'm looking forward to it.
Awesome. All right. Well, hey, thanks so much, man. Again, fredbrown.com. And you would too. I know you had shot over slides earlier. If you want to shoot them over to me again with these updates, I'll make sure I include them in the show notes to help get them out to people. And yeah, we'll cut you loose and we'll carry on with our normal chaos.
Beautiful. See you guys soon, hopefully.
All right.
Thanks,
take care,
Fred. You're the best.
You bet. Thanks, you guys.
Oof.
I'm gonna go jump off my roof again.
All right. Well, hey, on that note, since we're at like a little break between things, Capital One knows life doesn't alert you about your credit card. That's why they created Eno, the Capital One assistant that looks out for surprise credit card charges like overtipping, duplicate charges, or potential fraud, and then sends an alert to your phone and helps you fix it if you need to. That's another way that Capital One is watching out for your money when you are not. Capital One, what's in your wallet? See CapitalOne.com for details. For details.
So, all right, I'm going to make a bold statement. I don't want to say South Park was not good. I think they put.
I will mute you right now.
No, it wasn't like I didn't walk away from it going it was as epic as they've done in the past. I think they pulled out the stops, but for some reason for me, this one just felt. And I know they pushed through, but
So to me, honestly, I think one of the best things about that episode, and I just, if you haven't seen it yet, you guys really should. It's the first hour-long episode they've ever done. And obviously it's all about the pandemic. One of the best things that I loved about it is how hard they kept hitting themselves over the head. Just, but the conversations between Randy and Sharon, where, she's in like, really, seriously, Randy, people are hurting and dying and you're worried about a stupid special. Like, what's wrong with you? And he's going, but I'm helping. Like you could just like, to me, like that was the insight into them. And those conversations were, I just thought they did a great job with that. And then on top of that, like I said, the stuff with, Stan projecting all of his, anxiety and angst and worries about stuff onto Butters, as a pretext, I think is something that like a lot of kids are going through right now. And and adults too.
My favorite things were.
No, but
sorry. My favorite things were the callback to last season with the whole Mickey Mouse trip to China thing.
Oh, yeah.
And then also Cartman's 6-foot stick that he used to push people.
That was amazing. As he was pushing people out of his way. That was awesome.
I need to get myself one of those.
No, because the butter things, I don't know. I kind of felt just some things. It's like no one likes what's going on right now, and it's hard to make fun of it, And I think they tried, but like because the kids that are having the hard time right now, and it's like God, like you want, it's almost like a little too close to home to laugh. I try to laugh at everything these days, but like.
Yeah, but I mean, hasn't that? Really,
I didn't hate it.
I mean, hasn't that always been?
I'm not saying I hated it. I'm not.
Yeah.
What?
I was just gonna say, like, hasn't that always been them? Like, they've never been afraid to cut deep and cut fast.
Yeah, but like I said, I didn't say I hated it, but if I was gonna rate it, it was like 8.5 out of 10. When like some of them,
I give it that. Okay.
Yeah, like it wasn't bad. Like I'm just like I was expecting. Here's the thing, like almost at this point, it's like when I felt the expectation that it was going to be epic was too high. That's my when you walk into something thinking it's going to be the.
I get that. Like, and honestly, like I did. I mean, I thought it hit on. I thought it hit on every cylinder. I really did. Like, I just thought it was like they hit every topic they needed to hit. You know, I love the whole, you know, all the conspiracy theories about how it jumped species, you know, and just, you know, just the continued kicks in the ass to Disney.
Well, the spoiler alert, you know, him giving us protein in every jar of weed was a.
Oh, well, so and that, well, yeah, and then, you know, the huge spoiler, you know, the ending where, you know, Sharon, who's been against him this entire time and against, you know, the whole weed business, and all of a sudden, you know, yeah, oh, so you do, and so he's like, yeah, I'm just gonna go ahead and keep doing some specials.
Well, the fact that they called this sale, they mocked. Yeah, they're good at doing that. Anyway, I hope they do more. You know, as long, you know, if they're listening, you know, I know they're listening to the show to get our feedback from it. So
of course, absolutely.
Let you know,
why wouldn't they? Yeah.
Let you know, do some more, please. You know.
Well done.
I did. Hey, I want to give a quick shout. I went with the genetic jackpot, Joe Coleman.
Oh yeah, that store you went to.
We went and checked out Nerd Out Toys in it's right on 9 Mile on the Oak Park Ferndale border. I'm kind of by Ernie's, the sandwich place.
Okay.
Small little place. The guy is like super cool, welcoming about trading in stuff. Obviously gives him more inventory. Joe brought in a bag of old Marvel stuff because he moved, and the guy like gave him what he asked. And he was great to talk to. You know, not a lot of wrestling stuff.
Collectibles and stuff. I take it.
Yeah, they had, dude. He had the pristine Clash of the Titans Kraken in the OG box that said $9.90 on it.
Oh, shut up! And how much
for
did
the
he want
low
for it?
price of $800?
Nice. Oh, well, and again,
which I didn't think was.
Speaking of South Park, I absolutely love the "Hey teacher, I'm ready for skit."
Yeah, oh, that was the best. I showed my kids that part. I'm like, don't get any ideas. But this, the guy's got tons of Marvel stuff, good Star Wars, a lot of old school.
Like action figures and toys, or comics and graphic novels, that kind of stuff too, or?
Not a lot of books. It's
okay.
Mostly action figures. It's tons of Simpsons stuff. Like, you know, he had it all organized real well. Huge wall of Marvel, huge wall of Star Wars. Yeah, I thought, you know, it's gonna be a regular, you know. And I talked to him about like all the old crap I have that I'll never look at again. He's like, yeah, bring it. You know, I'll give you good. You know, because I'm fair about it. Because I'm not trying to, you know. So yeah, highly recommended.
Interesting. So I guess kind of, you know, lightly circling back to South Park, we were just cracking on Disney. Apparently they're laying off 28 or have already laid off 28,000 people, which goes, you know, no real surprise. Nobody's going to the parks.
Is that permanent, or is that just like, hey, we're temporary furloughing, or is
I mean, it's the PPE money ran out. We can't keep you around anymore. So I mean, I'm sure it really. I'm sure if the parks get back up to full capacity, they'll hire people back. They'll have to, but you know, it is what it is for now.
Yeah, and that was the thing. It was like, yeah, let's go to Star Wars now that there's no line. It's like, yeah, maybe let's not.
Yeah, maybe not. No. And then I guess there are two in the reboot department. There are and this one almost gave me a migraine. There are conversations about a Hackers reboot or sequel, one of the two. No. just no.
You wouldn't want to see it done with modern technology?
You wouldn't want to see any of the original characters reprise their role? Or original actors?
They're all our age. Like,
yeah.
Like they're going to be what, CTOs now?
Yeah, exactly. They're all in executive roles.
and they're bitching at the damn kids trying to hack in their systems. Like what?
Yeah, they want to get their hands dirty because I haven't touched a GUI in 10 years. And it'll be great. You don't. I'd watch it. Then again, yeah. I'll watch anything. There's so much trash that I'm watching on TV right now. Tulio got me into 000 on Amazon Prime.
Okay.
and this is how hard up I am to watch things.
What is it?
It's following an Italian mafia, like a Mexican cartel, and like some group. I can't keep track, and it's all in subtitles. And but it's
And I know how much you love
there's some, like,
subtitles.
awesome,
Yeah.
Oh, I know. There's like some awesome scenes like every 15 minutes, which like reels me back in. And then I'm like, I'm tired of reading. But it's good. I don't know how else to describe it.
So, and
Don't make
then,
me work.
yeah, right. And then the other one is apparently The Craft Legacy is coming out.
End of this month on what service?
I forget.
What about cheese?
On demand everywhere. October 28th.
Yeah, no, the old 90s movie The Craft, Bob. That was, yeah.
What the hell's that?
You never saw The Craft? The
No.
4 girls form a coven, practice witchcraft, things go wrong.
Yeah, there's no way I would have watched that.
not in the 90s. No. You can go back and watch it now. It'll be fine. Actually, and this is one I wanted to get your take on it. So the WWE came out with a whole bunch of new rules and guidelines for the wrestlers, where they had previously said, hey, we're not going to touch your Twitch stuff. We're not going to touch your Cameo stuff. We're not going to do any of that stuff. And then apparently they did a 180 and said, oh, yeah, not only are we touching it, but you're assigning it to us. We are your duly registered agent. All money will come to us and we'll pay you however we pay you. And that's just how that's going to be.
So door number A, John Cena would never have been John Cena if it wasn't for the WWE. It's not like you're
right.
It's not like you're an actor and you're playing a role and then you get other acting jobs and you're just as famous. There's only one dance. There's other wrestling companies, but WWE is like the stage.
Right.
And and if he makes, that's why he copyrights their names, because he owns their property, he owns their character. Just like George Lucas owns Chewbacca.
Right.
Like Chewbacca, you can't dress up. So, but then that was a reason why like Rhino left and went independent, because not that he made more money, but he got more freedom. So like you're going to see a lot more of these stars just saying, hey, I'm going to be better off doing my t-shirt licensing deal with Hot Topic. I'm going to do a YouTube series, on if OnlyFans, if you make how much does Bella Thorne make? $10 million a month?
Dude, so they had so Black China apparently makes $20 million a month.
Who's Black China?
Rapper artist. And then Bella Thorne's up over 10 million.
That's a month.
Yeah, that's a month, Bob. That's a month.
Because she showed a nipple on the internet? Like, I'm sure if you Googled it, you could. Huh?
I would love to see what percentage, like OnlyFans will tell you you're in the top X percent of creators on OnlyFans. I would love to see their percentage, like number one, top 0.1%.
Oh, I'm sure it's like podcasting. I'm sure there's a Joe Rogan making 100 million, and then there's 72 other guys doing D&D podcasts making not 0.0
a month.
Right.
But that money though was like, are you like? I had no idea that.
Oh, dude, I had no idea it was like that. I see, like, when I saw those numbers, it absolutely blew my mind. I was like, are you shit? Like, I didn't know. I guess I had no clue. Like, everybody's made every OnlyFans joke in the world since the pandemic started, because they were like, hey, you're about to see your neighborhood bartender showing some skin on OnlyFans. Just shut up and move on.
Cardi B makes, it'll be $100 million a year. Nobody talks about that.
Yeah.
But yet they bitch about Bezos' salary, who jackholes that hires 200 million people. And then Cardi B makes $100 million. And you're like, cool, dude. Cool. Love it. Who's Mia Khalifa, a porn star? She makes $5 million a month. Pia Mia? What the hell is that?
Musician.
I had no idea.
$2 million a month? A month.
Yeah, we're doing
this
it.
This is a bunch of shiza.
We're doing.
I'm hanging my ball out on OnlyFans next month. You heard it here first. I gotta make more. I'll make at least $2, won't I?
Yeah.
I mean, I'm sure Tulio will
Penny.
subscribe. That's yeah.
Just got to get the proper lighting and just like have the left one out, and then I'll do the bat wing.
Right.
And then I'll charge $4.95 a month, and then come on, like those numbers are stupid. After Fred and this,
But speaking of stupid numbers, I know this was your favorite story of the week. That arriving yesterday at the International Space Station, the new space toilet that cost $23 million.
Space toilet.
That's some better be heated seats. I better have footrests. That bowl better be licked clean when it's done. Like that. There's some features that are gonna need to happen on that thing. Needs to be a little bit elevated, like 4 inches more off the ground than what normally are.
So you don't need a poop stool?
No, because no stirrups either. I just want a nice, like a slight recline.
Built-in bidet.
Oh yeah, no, I want no wipe bidet. Like, typically they're like one wipe done. No, none. I want gnomes living in there, getting 2 mops out there, getting the last of it done. $23 million. No, I always heard there's always been stories for years about like, taking a dump. Like isn't like a vacuum tube that like that they dump in.
Oh, there was a Big Bang Theory episode about them trying to basically fix a toilet on the ISS at one point.
But what happens if you get it's got to be like a bicycle seat part that you like fasten to your, and it's like what happens if then it just like floats around and you got to catch it with a fishnet? You can't like throw it out the window. Like what are you supposed?
I mean, I would hope there's some sort of artificial gravity in the bathroom. Like let's just hope that's a thing.
I gotta look up the story. Apparently, like in the '60s moon landing, apparently the guy they were throwing man product around. Apparently in a rocket. I don't know where I gotta look it up. It was apparently there was like one of the guys thought it was funny. Yes, one of the astronauts thought it was funny. God, I wish I had more details on the story. I caught it in passing and I didn't bother to retake on it, but it'd be perfect to talk about right now.
Wow.
I'll have it next week. Breaking news from the 60 space launches. What the hell's on the toilet though? What is it? What?
Dude, I don't know. Apparently, it cost $23 million to make a toilet work in space. That's.
So hold on. We're so proud of Jimmy. He got his aeronautical engineering degree, and he works for NASA. And his project the last 5 years was.
Hey, so what have you been working on lately? Space toilet.
He's not telling nobody he's working on space. He's telling
I can't talk about it. It's classified.
Secret space mission
astronaut health stuff.
Yeah.
Space station saving lives.
Right. Just making sure everything's in space. That's what I'm working on. Yeah.
Well, I'm trying to find something funny in this
article. So dude,
nothing.
Apparently, and you shot the story across. Apparently, they were cleaning up Southwest Detroit, and over the course of a month, they found 25,000 Whippet containers. Like, so here's my question: did Whippets never go away, and I just I wasn't paying attention, or are they making a comeback and I wasn't paying attention?
I think they never.
No, this reminded me of the story. No, do you remember when I told you when I ran out of gas on my Cadillac? Yeah. I forgot how to read 70s gas, and I was stuck in the middle of 59, and I had to walk to the gas station.
Oh, and all the little pint bottles.
There's the pints of whiskey, or they weren't whiskey, they was schnapps. It was freaking blackberry brandy, and it was Whippets containers, and I was up to 150 to 200 of each just on the Rochester on ramp to 59 West. Right, we've all taken that 1,000 times.
Yep.
At least I have. And now this one is so that's when the story hit. I'm like, oh my God. Like, could you imagine like certain spots and like the guys and that's the thing, like you put it in your old McDonald's bag like the rest of us
and throw it away.
Meyer bag, that you just bought a couple Mountain Dews. They give you a bag in Meyer, put it in there, you clown.
I saw Jer posted earlier today, and he was like, "Oh yeah, nice look." riding around your Mercedes, throwing your used needles out the window before you pull into the casino.
Yeah.
Pigs, God. But like, yeah, then I was literally up to like 200 whippets by the time I got to the gas station. So I can't imagine like how they're getting thrown away. Like 25,000 of them though. Where do you buy them?
I don't know, but somebody was making a whole hell of a lot of whipped cream.
Yeah, or wasn't.
Yeah.
That's one of my favorite scenes in the movie Waiting, where she's trying to make the chocolate sundae, the hot fudge sundae, and there's no whipped cream and anything, and you got Andy Milonakis in the back.
I love that movie.
I just watched it this weekend for no reason.
Nice.
So
That's the best reason.
Good, interesting story about Twitter that came out. Because there's always been.
It's stupid.
Well, no, I mean, so this has always been one of the things
It
is.
Sucks.
Social media companies are always very left leaning. They're very, they're biased towards the left. They shut down stuff on the right. And so, pretty immediately after the news about Trump broke on Friday, Twitter released an update to their policy and said, they're not going to be, allowing any tweets that are, basically wishing the president would die, that kind of stuff. And then you've got, quote unquote, the squad, AOC and Rashida Tlaib and those guys that are like, well, hey, where was this when we were getting death threats? And they were posting screen captures, literal death threats when that was happening to us.
Well, look at all the Star Wars characters that get death threats. I mean, dude, death threats isn't.
Yeah.
It's an everything. It's an everyone thing on.
No, for sure. But But like I said, my whole, the only reason why I shared this story was because there's always just this perception, and you hear that there's such a left-leaning bias in these social media sites. And so, but, is there really, if they were, being protective towards Trump in this situation?
I think they just had to be human for, and then they have to report accordingly. I mean, there was a huge, was she on Rogan, the CEO of Twitter? If you ever watched it, Tim Pool,
CEO of Twitter,
it was very
is a man.
one-sided, very leaning. Huh?
The CEO of Twitter is a man.
No, it was a woman at the time. It was like a year or two ago on Rogan.
Did they were just ever give it up?
Trying to. What's that?
Dude. Jack Dorsey is still the CEO of Twitter.
Were you thinking of maybe Ellen Pao, who was the CEO of Reddit for a while?
Maybe. I'll have to find out who it was. No, it was Twitter. It was you guys talk amongst yourselves.
Well, and it did say Jack Dorsey sat down with Rogan. And I mean, and it's not like
I don't remember seeing that.
It's not like he's very effeminate looking. So
no,
I don't know what to tell you there, Bob.
No, and who the hell were they talking to? I don't know. I could have sworn it was Twitter.
No, but I get your point.
No, but I think there's so many, because the problem with she was an executive.
Okay.
It was Twitter execs. If they take, it was Twitter executive Bilea. It's cut off there, but I don't know her whole name.
Good enough. Yeah.
Anyway, what was my point? What was I talking about?
That they were lighting her up. Yeah.
Just how do you police? And you have all these troll accounts, and you have people just spinning up garbage all the time. You know who the troll accounts are. Let's just be candid. You know who they are.
For the most part, yeah.
Yeah, you don't have your picture. It's some stupid name.
It's an egg.
Right. But how do you police it? I mean, I thought when you death threat the president, though, that's on a different level. That Secret Service knocking on your door.
Secret Service comes knocking at your door at that point. Well, there's a difference between making a death threat against the president and wishing the president would die. Those are two different things.
That's another great meme I got from somebody. It was like, you must condemn hate. I hope the president dies. It's and this 5 minutes later, You know.
Well, I mean, that's right up there. With if I were there, I would just run the BLM protesters over. Hey, I don't understand why you're not being, nice to people and civil in these times. So, I mean, it goes both ways. It always does.
Why don't they just call it a slow roll when they're in the middle of the street and then no one will run them over?
Perfect. Dude, I loved the
Just going on a
story.
leisurely. We're just going on a leisurely bike ride. Well, I
Right,
don't know what
that's
you're
all it
talking
is.
about. We're not protesting.
I love the story about the dumbest hack that this infosec firm had ever seen. It was just absolutely amazing. Where literally they were trying to get access to a location that had fingerprint scans, and so they tried. They went ahead and they uploaded. The hackers uploaded their fingerprints into the recognition system, thinking that they would get access to the building and then be able to use the fingerprint scanners and they would pass through. Well, the hack was detected and now the police have your fingerprints. They were able to rather quickly go get them.
It's like shooting somebody with a bullet that you pressed into the magazine. You know what I'm saying? The casing pops out. It's like, oh, there's your perfect fingerprint on a brass casing.
Yep. Doesn't get much better than that. There was one I did, because I mean, even as old as the movie is, there were the top 10 things about Star Wars that still bug people. The one with Leia's accent. I mean, I think everybody's noticed that, where she's very, very British at times, very, very American at times.
Dude, Padme did that same shit too. Or she had that awful monotone shit accent in episode 1.
Like mother, like daughter.
And then the whole thing where, Vader's standing right next to her and doesn't realize that she's his daughter. I mean, we all know that that's just because that hadn't been written yet. The one that always bothered me was, Obi-Wan doesn't recognize C-3PO and R2-D2 as the droids that accompanied him through the better part of the 3 prequel movies.
Well, with as many droids as he went through, though, I could forgive that one, I think.
See, was he being was he being coy? Because obviously he knew who Luke was, like flat out, because he's looking over him.
Right.
Was he
for sure.
Was he being coy? Was he just going, I don't remember owning like trying to be like, he didn't want to like step up and just go like, oh yeah, I used to be this badass general and
these are the droids I'm looking for. Yeah.
Right. That's what I'm saying. Like, and that's the other one. It's like no life forms detected an escape pod, so let's not blow it up anyway.
Well, dude, I mean, that was didn't the Family Guy spoof hit that one? Like they're like, oh no,
right.
What are we paying by the laser? And then
what was
the one that's true, and this is true both in episode 4 and in episode 7. And I think there's actually a plausible reason for this one, where just the apparently how quickly the Jedi are forgotten. And I don't know that it's necessarily that the Jedi were forgotten very quickly. I think that in a lot of cases you're dealing with remote planets where it's not like, Obi-Wan Kenobi was hanging out on, Exegol. It's not like Obi-Wan was hanging out on Tatooine or, wherever. And so unless there were planets that had a lot of interaction with Jedi, why would they know them as more than a myth anyway?
It's folklore for most people.
Also,
it's like the Mandalorian season 2. Like the whole point of it was like, this ancient sorcerers. That's what they were kind of, they didn't know what they were.
And Darth Vader suppressing, knowledge and referencing them and, making them something forbidden.
All the deletions from the, the Jedi archives and all that stuff. Well, and speaking of the Mandalorian too, so I don't think I shot it across, but so they basically figured out Ahsoka Tano and whoever shows up with her, because the rumor has it there may be more of the folks from Rebels that show up during
that was Hera.
episode.
No, that was confirmed that's Hera.
No, from the trailer. No, I know. I'm just saying, but they're saying that Ahsoka Tano and whoever else shows up is likely only showing up in the 5th episode of the 2nd season, because that is the only one that Filoni directed and wrote himself. And just because of how involved he was with the Clone Wars and Rebels, it just makes sense to everybody that, all right, it's going to be episode 5 that Ahsoka shows up, and whoever comes along with her is going to be popping up in that episode.
Can Freddie Prinze Jr. come back, please, and be Karen? What else his name? Kanan. What the hell's his name?
Oh,
Freddie
Kanan.
Prinze Jr. is the voice of Kanan. Thank you. God, why can't I think of his name? Yeah, can he come back and just be him? That would be.
Oh, but isn't he dead?
It's Star Wars, dude. Just put some spider droid legs on him and have him walk out. This is something to say. No, he survived the Sarlacc pit. No, Star Wars. Who cares? Have his Walt Disney frozen head on a freaking R2D2 block.
I think that was one of the memes that came across was, the no one ever really dies in Star Wars, but then okay, this person dies, this person dies, this person dies, and then Darth Maul gets cut in half. He's like, yeah, I just need some garbage to go ahead and pack into here, and I'll be fine, and then I'll come back, I'll be good.
Yeah, he's good.
So
he's good.
Apparently one of the issues that's going on, and I guess I didn't even really think about it. Like apparently there's a huge, just like firestorm brewing between publishers and local libraries. Because I guess like ebook usage or ebook, lending is through the roof. Publishers obviously want people to buy books. They don't want them going to their library. And apparently like ebook use has, in some cases gone up by like 400% in some cities that are doing this. And it's, I guess I understand the issue, but
they're all going to need to learn how to play nice because none of that shit's changing anytime soon. I'm just throwing that out there.
Yeah.
Well, there's Neil's working on a project with some Oakland County community centers about putting in esports divisions and wings just to try to, get some of the because the youth. When's the last time my kids have gone to the library? Not since they had to in second grade. So trying to give people the community reasons to come back to their community centers instead of you can only do bingo so much. And I want to start playing Squadron, by the way, because it's I guess it's inter console. So if you got a the new PS5 or whatever, PS4,
nice.
Works with the Xbox One, works with PC. So yeah, a bunch of people texting me going, "We need to get a crew for Squadron." So I'm like, "All right, I'm in."
I see everybody talking about Among Us, and I have no idea what it is. It's like cute little characters, I guess. It's called Among Us. It's a multiplayer. You're, I guess, a team of like little rainbow colored astronauts or something. I don't know what it is, but everybody's talking about it.
Who's everybody, Randy?
No, I mean he's not wrong. I mean I've seen a lot of people posting about it, and I haven't bothered to even click through to see what it is either.
Like I heard they even canceled the sequel to just improve the version that everybody's currently playing. I have no idea what the hell the game is. I just know it's team cooperative.
I don't know.
And then of course the latest delay announcement. Dune.
Who didn't see this coming?
Yeah.
Everything's getting pushed.
Yeah.
Dude, think of the shit that we're gonna get like next spring between Wonder Woman 84, Top Gun, Dune,
Black Widow.
Are we gonna get a Star Wars movie?
Are there gonna be any theaters left to go see him in?
Other good point.
What was it? I think it's Regal.
Regal
just announced they were shutting down.
Yep.
So whoever's got the VC firm with the purse strings is gonna gobble up all the other ones. They'll exist, but it'll be different.
Well, VC didn't work out too well for what the hell was it? Movie Pass.
Right. and let's not forget the wise prophet Brad, whose venture capital is not the end game.
I guess it depends on who's getting the check.
Apparently, James Bond was James Bond was the last straw for the Regal closing.
Yeah.
Well, they just get it over with and make Idris Elba James Bond. He would be, like, in my opinion, like the coolest James Bond of my lifetime.
Interestingly enough, I was just reading stories where I guess Tom Ellis, who plays Lucifer, was because season 6 was announced, one of the leading contenders to be the next Bond, which I can't say I disagree with.
Does he have to fake a British accent, or does he have a British accent?
No,
I've never watched.
Yeah, he's British. Yeah.
I just want Man from Uncle. Man from Uncle, the series would make me the happiest guy. That to me, I can't watch that movie enough.
Didn't they just announce though that Tom Hardy was the next James Bond, or was that just a rumor?
Yeah, I don't think they haven't made any announcement on it whatsoever.
Yeah, okay,
not to my knowledge.
Because no, like he was supposed, like in my opinion, he was going to be like the next big thing. Then Venom sucks, and then movie where he's a twin sucked. You couldn't understand shit unless you were like from like a 30-person city in Welsh, in Wales. You couldn't like there was such a bizarre spoken language. I'm like, I don't have the time for this shit. Like it's kind of like reading subtitles in a series.
I was gonna say, it's enough with the subtitles. Yeah,
just can't. But no, because Hardy was freaking awesome in Mad Max.
Oh,
they're supposed to make another Mad Max. They're supposed to make another one of those though, with Charlize Theron. Who knows anymore? It's all this like, what's the next Star Wars movie? Like, is that gonna ever be a thing? What's the next? So wait, what's the next 2 Marvel movies? Is it just Wonder Woman? Is there another one?
That's DC.
Wonder Woman's DC.
Black Widow and Shang-Chi, right?
Yeah, and they already announced those were pushed back into 2021.
Yeah, they pushed. Yeah. Okay. And you know what I could do without? You know what I'm sick of? Fan trailers.
Yes.
Did I bitch about this already? I saw like Joker 2. So I'm like, sweet. And it's all like just clips from like garbage. And I'm like, yeah, you suck as a human
so honestly,
being.
one of the and it was very well put together. Somebody actually put together a promo clip of Tom Ellis as 007, just using scenes and snippets from Lucifer. And it was goddamn amazing. It was a Bond trailer. It was so good.
See, we always talk about where these people have time, and here's the guy that did a 6-hour Age of Empires 2 definitive edition on Saturday, and then I'm gonna bitch about that guy having
exactly
too much to do the stupid fan trailer. See, I should have taped it and then put it on like ×8, and then I could have shared it, and no one would have cared.
And you'd have told, and nobody would have cared. All right, well, that's all I got. Anybody else?
I wanted to talk about the other WWE story, tattoos in video games. If you have a wrestler in a video game and that wrestler has tattoos, do you have the right to put their tattoos in the video game too? Apparently, that
was an interesting one.
Yeah.
Why wouldn't you?
Well, because as the tattoo artist, you just put the art on the person. You don't necessarily assign the rights. You're still the artist. Doesn't matter what the canvas is. So you didn't give the rights. Like you could, you'd have to just clear it with the artist who created the tattoos.
Dude, that shit's like getting a lawyer. That argument is getting lawyers paid. There's no other reason for it. That is so cutting the garlic with the razor blade level. Like it is so bad. Like,
I mean, I understand protecting your artwork too. As the tattoo artist, it's you created it. It's like, recreating, somebody taking this podcast and posting it somewhere else and calling it their own, or using it without our permission.
But it's like half the Comic-Con artists are just doing like Batman shit, and it's not even a variant. They're just doing sketches of characters that already exist. Like isn't that kind of like a tattoo? Like you're doing a work of something that already exists. Like,
well, and wouldn't that just fall under the category of likeness rights?
Yeah.
I don't know.
I mean, your tattoos, at that point are part of your likeness, and that's what they are licensing is your image. And I would assume,
I don't
again, I'm not a lawyer, but I would assume that would come down to the talent when they sign the contract, signing over their likeness rights. That would be on them to make that's on them at that point, not the WWE, I would think.
Yeah, that could be too. You signed over your likeness, that includes your tattoos, but you don't have the rights to sign over the tattoo art. So it's on. Yeah, that makes sense.
Did you watch that murder family documentary on Facebook or on Netflix? It's like the #1 ranked thing.
Yeah, no, that's actually next on my watch list because I'm helping another show talk about that.
God damn it. just put it this way. We watched it late at night, and I needed to watch like an hour of fart videos just to cleanse my soul so I can go to bed at night. Like, it's such.
I've heard. Yeah.
What's it called?
It's the number one rated thing on Netflix right now.
American Murder, The Family Next Door.
Yes.
Yes, Family Next Door. And it's all like Nest footage and texts and voicemails and
Ew.
Well, apparently there's another, and I guess that, everything is kind of like the Fire Festival now. There's another take on that story over on Hulu as well.
Oh, of course there is.
From what I've gathered.
I gotta watch it. All this documentary do is gonna piss you off, but it's like there's nothing else on TV, so just freaking watch
Bob,
it.
that's all any documentaries do. Let's be clear. That's what they're there for.
No, some of them are funny. This is like there's nothing in this that's like, oh wow, like that was interesting, or like that was a neat twist. There's like no neat twist. It's just it's just puke.
It's like that movie Very Bad Things. Don't things ever get better? It's not called Very Bad Things eventually getting better. It's just called Very Bad Things.
Yeah, like this movie will make you angry and piss you off, and you don't want to go to bed at night.
It was just funny. Like
anyway,
I said, I sat down and had my kids watch bits and pieces and getting them through a high score. And it's actually made them interested in going back and playing some of the old games. Like now that they see the story behind what those Space Invader characters were supposed to be on the Atari 2600. It's like stuff. That's what I mean. So I guess that's the positive side of documentaries.
Then after the third time that they die, they'll never.
Then they're not interested in it. Yeah, they're going back to
You mean they just go faster until you die? There's no winning.
Yeah, no, there's no winning. Yeah, no, they just keep going and keep dropping down, and
until they go fast. All right, well, we're gonna wrap things up for episode 368 of the IT and the D Show. On behalf of Bob, Dave, and Randy, do us all a favor: drink up your drinks, get your phone numbers. You don't gotta go home. You just gotta get the hell out of here. See you next week. Drive careful. Beat it.
All right, see you guys.